From the Health Science Desk of the Boston Globe, I'm Stephen Smith, and this is Be Well Boston. For years, women were told that they needed to get pap smears every year to prevent cervical cancer. But now the wisdom about that is changing. Dr. Raj Krishnamurthy of BU and Boston Medical Center is here to talk about an important women's health issue. So what is the current recommendation regarding pap smears?
So when to start screening for cervical cancer, and that's why we do pap smears. So one, you should start screening after the age of 21 or within 3 years of becoming sexually active. So that's when you start. And then the recommended frequency interval, certainly in your 20s, the recommendation is to do it every 1 to 2 years. And once you've had 3 normal pap smears, you can back it off to every 3 years. Women over the age of 30, again, those every 3 years if they've had a history of normals, or if they've done something called an HPV test, which frequently many clinicians are starting to do. It's a screen for human papillomavirus that's been associated with cervical cancer. So if you have had that test and that's negative and you're over 30, every 3 years is just fine.
Why had it been believed that for so long women should have a pap smear every year?
Now with the advent of better health care, more frequent health care for women, and also with the HPV test, we can identify women who are at lower risk, who don't need the test so frequently.
So important to have that discussion with your doctor to get a sense of when you should be having this.
Absolutely. The other recommendation is women over the age of 65, they potentially can stop screening, or if you've had a hysterectomy, you could potentially stop. So that discussion about you and your health risks and your behaviors is really important. That ongoing dialogue is probably the most important thing.
Dr. Raj Krishnamurthy, thanks. And for continuing health news, stay with boston.com/health and the Daily Dose blog at boston.com/dailydose.